Hello, today we're going to talk to Dr. Bowen about autoimmune diagnosis and testing.
Thanks, Sam. So today we're going to talk a little bit more about autoimmune diagnosis and testing. And so I thought that we would start out this conversation by asking M, how did you get your diagnosis of autoimmune disease?
Yeah, so back in early 2016, the first thing that happened was my scalp got really itchy and it got really flaky. And so I had some sense that I didn't really want it to be true, but that maybe I was developing psoriasis because a family member had that, and so I had seen that happen to them, and so I thought, is that happening to me? But then I started developing lesions on my body, and they were especially like in the creases, like under my breasts, around my navel, under my belly. And I didn't know about inverse psoriasis, so I didn't know that that could be related. So I just thought that I was having rashes. And so I was trying to treat these rashes in all the different ways that I know to like be good to the skin. And it just wasn't resolving and clearing up. And then I developed a plaque. I think I share photos with people who are in our program and maybe on one of these other videos of, kind of like a quarter size plaque that developed on my thigh. And so that was an indication something was happening. It wasn't just about creases and moisture, and it was beyond my scalp. So I went into an urgent care clinic and they said, well, it looks like psoriasis, but it might be yeast or something else. Um, what we're going to do is we're going to give you a prescription for steroids. And the doctor basically said, if it makes it better, it's psoriasis. If it makes it worse,
It's
it's probably.
yeast.
So there was a diagnosis that came with how my body reacts to this treatment will give us some information. But that was really how I came to my diagnosis was I took the steroids, it all cleared up pretty well. It came back pretty quickly after I was done taking the steroids, but I did see that reaction.
That, yeah, definitely trying something and then seeing how your body reacts is one way that we can learn a lot. For me, my diagnosis was blood tests. So I had noticed that I was feeling more tired and I was having some weight changes that weren't really consistent with what was going on in my life. It just seemed like something different was happening with my metabolic health. And my hair was falling out. I had really, really fine flyaway hair and just wasn't feeling like myself, and got some testing and they found autoimmune markers against my thyroid. So I was diagnosed with Hashimoto's thyroiditis at that time. And then years later, it also was blood work that helped to diagnose possible mixed connective tissue disease through an auto antibody. So it's called an ANA test. And so that's one thing that you have at your disposal as far as like getting blood tests. So normally PCPs might be the people who would help you to get some of the blood tests. Or for M, did you go to a dermatologist or did you go to just your primary care?
I went to primary care initially. I did get a referral to a dermatologist. Um, and unfortunately, with the dermatologist, I was just kind of told, like, here are topical steroids that you can use. There might be light treatments that you could receive, but your insurance won't pay for them, which led me actually to do some clever sunbathing moments to see if exposure to sunlight would help, and it did. It was one of the things that helped reduce the prevalence and the spread of my psoriasis, but it was very specific to just treating the skin, right? And there wasn't a lot of curiosity about what is going on in your systemic health that's making this happen on your skin.
That's so important because once you have a diagnosis, then you at least can start to explore treatments that are specific to that diagnosis. So, why is getting a diagnosis so important? Well, then you know what you're dealing with, even if it's not something that we love hearing, but it really helps to then at least give us that basic information that we can build on. And so, like for Hashimoto's thyroiditis, one of the main things that I did was went gluten-free. And then another thing was taking some thyroid medications or some selenium. And so some of these pieces then helped to bail me out. And now I'm in a state where I have negative thyroid antibodies, which is good. We don't want to see those positive because those antibodies, when they're higher, it means that your immune system is really attacking your thyroid. And so there isn't really a blood test right now for psoriasis. It's more about what you observe. So that brings us to,
Right.
it brings
Yeah.
us to how things show up. Sorry, what's that?
Right. I was curious, Christine, if you could help folks out, especially if they suspect that they have an autoimmune disease. They've noticed, Googling my symptoms. There's a few things it might fall under, right? It could be this, but this also seems possible. And someone in my family had this, and that could be possible. So if you were to recommend like a place for people to start around testing, or tests that you think everyone should get, to know more about their health, and about specifically about autoimmune health, where would you encourage people to start?
Yeah, so first I would say looking at your symptoms and just kind of doing that, full body check and seeing what your symptoms are and kind of jotting those symptoms down, even just as a baseline of how you're doing right now. But then when you have certain symptoms, then it can lead to different types of testing. So autoimmune diseases there's so many and so many different ways that they present, that you can have totally different symptoms and still have an autoimmune disease that affects your gut or affects your skin or your thyroid, and that all of these things can be totally different. So you look at your symptoms, and so the symptoms of autoimmune disease can typically be general symptoms or more specific symptoms. And the general symptoms might be things like fatigue or brain fog, or just not a general feeling of like not feeling well, a little bit of achiness, maybe a little bit of hair thinning. But then when you get to these more specific symptoms, things like big clumps of hair are falling out, or you have, spaces with no hair in them at all. You have skin lesions, you have diarrhea, maybe you have bloody diarrhea, maybe you have constipation. So some of these new changes, maybe you have joint pain, maybe your kidneys are struggling to function normally, maybe you have issues with blood clotting. So all of these things, typically there's an overarching symptom of something inflamed and not feeling great. You may have fatigue, but these other symptoms can then get you closer to understanding which tests you need to do to really tease apart what your diagnosis is. So when we look at the testing, my typical testing wish list just for general tests, so you had asked about general, would be things like a complete blood count. And so that tests your white blood cells and red blood cells and can pick up things like anemia. It can even help to diagnose some types of autoimmune disease. And this is a relatively inexpensive test. There's another one called a comprehensive metabolic panel, which can look at the health of the kidneys, electrolytes, your fasting blood sugar, your liver markers, see how you're absorbing protein from your food. All of these pieces can be tested for with just this one little panel, and it also is a relatively inexpensive panel. So even if your provider is not willing to or isn't ordering a CBC or CMP, CBC, CBC is complete blood count. Comprehensive metabolic panel is CMP. I apologize for my heavy use of acronyms. So if they're not ordering those things, those might be things that you can self-order, self-pay for like under $50, both of those tests. And we'll make sure that we provide you a link with a company that allows you to do self-order, self-pay tests, just in case you want answers and your providers are roadblocking you from getting testing, as happens in our current model. So CBC, CMP, the next ones that would still be in that general list would be things like B12 and folic acid. And so this can help us to pick up whether or not you might have deficiencies in those, which can also point to different types of autoimmune conditions or malabsorption or certain types of anemia that can be autoimmune could show up with some of those low. Another thing is vitamin D. So this is something that is not being covered by insurance more and more, but I still think it's a very important test. Our immune system status can depend on how healthy our vitamin D levels are. So just knowing that a more ideal reference range for vitamin D is between 50 and 70 on that blood test. And so when you see numbers that are like 8, then you know that that's really playing a part in potentially compromising your immune system or making it more vulnerable. So vitamin D is very important. And then also TSH is the main thyroid marker, but I like to order just a little bit deeper thyroid panel, even on a basic blood workup. So TSH is thyroid stimulating hormone. It should be about 1, is considered a more ideal range for it to be in, but you should see it, at least if it falls within the reference range, too high or too low. And then free T3 and free T4 are actually the hormones made by the thyroid. So getting those 3 pieces, so you have the message from the pituitary to the thyroid, which is TSH, and then you have the 2 different types of hormones that come out of your thyroid, which are T3 and T4. So just having those pieces is great. And then ferritin is typically a marker that can tell us whether or not iron is low in our system. But it also sometimes is high when our bodies are inflamed, or if we have like a viral infection that is affecting our liver or some sort of liver compromise, ferritin can be high. So it can actually serve as an inflammatory marker in some folks. So if you see it's high, and it also can mean too much iron in the system in a subset of the population. So just know that there are other reasons why ferritin could be outside of normal, but it would be really good to get that checked to see how your iron is doing. And then the one that your PCP is more likely to order is a lipid panel, which is your cholesterol markers. And that can tell us how you're absorbing fats from food. It can tell us how you're breaking down sugars or starches. It can tell us about how much protection you have. If the HDL or the happy cholesterol is in good range, it can actually be protective when you have other types of cholesterol that are too high. So those are the general tests. And that's quite a bit to talk about, I know, and we're just at the general tests. But I think that it's really important for us to know that we can dig a little bit deeper. So when we look at ruling out or ruling in about 12 different autoimmune diseases, there's one marker that's called ANA. But I order this anti-nuclear antibody. I order it with a reflex, where if it comes back positive, then it will order all of these other markers to try to help us identify why it's positive. So this can rule in or out scleroderma, lupus, Sjogren's syndrome. Sometimes it can point to things like even an allergic reaction to a medication. So there can be so many different things that you can learn from this. So like mixed connective tissue disease, CREST is another acronym for an autoimmune disease. So there are a lot of things that you can learn just from that ANA. Inflammatory markers would be something that I think is very useful. And even if your ANA doesn't come back positive, or some of the other autoimmune tests that I'll talk about don't come back positive, you might see that your body is still making some inflammation. And so I would expect that when your psoriasis is flared, and I would expect that when my Hashimoto's is flared, that our our inflammatory markers are higher when our autoimmune diseases are more active. So something like fibromyalgia, where it's well accepted that that's an inflammatory condition, hasn't been officially recategorized as autoimmune, but it's coming. A lot of my clients who've had fibromyalgia throughout the years, they have very high inflammatory markers, but then there's nothing positive saying, oh, you have this autoimmune condition. But now I feel like the literature, the science, the research is catching up. and starting to see like actually we do think that fibromyalgia may be an autoimmune condition. Well, we sure know that it's associated with inflammation. So for my patients who have fibromyalgia, or for ourselves if we're in flare, these markers, so C-reactive protein, and then another one called ESR, which is also known as sed rate or erythrocyte sedimentation rate. But ESR and CRP are two markers that can be high when somebody's in a flare or if they have a significant amount of inflammation in their body. Specific to Hashimoto's, and we'll talk more about all of these things going forward. I just want to give you a little bit of an overview. But for Hashimoto's, there are two thyroid antibodies. There's TPO, and then there's there's thyroglobulin antibody. So TPO is thyroid peroxidase antibody, and the TPO is the most common thyroid antibody associated with Hashimoto's, versus thyroglobulin antibody is less common. And if you see that those are out of range, that's diagnostic for Hashimoto's. That's all you need is a blood test for those things to know that you have Hashimoto's. And then I follow the antibodies over time to make sure that somebody is doing better and better. And then the goal is always to see the antibodies go negative. The other type of, oh yeah, sorry.
Go ahead. Well, I was going to ask if somebody does self-test, right? They self-test, they get these results, and they see this. Is there a frequency that you would have people
This is a
retest to see
great
if
question.
things are changing? Is there like, I want an annual baseline, or only if some new symptom comes? Like, how do people know, because they're initiating this themselves, if they're doing self-ordered tests?
Yeah.
How do they know how often to be on top of it so that they really feel like they're current with what's going on with their body?
Yeah, that is such a great question. So I'd say one, at least a baseline. So as soon as you're curious about these things, get these foundational tests to be able to just rule in or rule out conditions. And then if you're picking to embark on some sort of a journey, like our program is 3 months, right? 3 months also happens to be the period of time that it takes to heal the thickness of the bowel, or to like grow new mucosa in the bowel. The digestive tract contains like 70% of the immune system. So 3 months of doing something that is positive, or some sort of push forward in trying to improve the status of your autoimmune disease, I think 3 months would be a good interval to retest. And then, in the beginning, you might retest more frequently. And then after you've gone into remission, you might not be as curious. You might only test once a year just to make sure that it's not, still present or popping up. But once every 3 months, especially when you're really trying to affect change with it, you want to see some sort of positive benefit, not just, you should be feeling better symptomatically, but you also want to see the labs change to know then, oh, my immune system is also feeling better, not just
Right.
I'm
And
feeling
see
better.
that improvement in the function. And so I'm curious, like you mentioned earlier, that part of your treatment for Hashimoto's is taking a medication. If folks are taking medications for their symptoms, would you want them to know something else about what their tests are going to look like, or how often they might test? Say, like, I'm not on a systemic, but I know a lot of folks with psoriasis
Oh,
and
like a
rheumatoid
biologic
arthritis,
treatment.
and right,
Okay.
we'll take something. So if I was to do that, or if we're talking to somebody who's already um, started a course of medication, like, does that change your recommendation about the frequency of testing?
So let's say somebody is just newly going on medication. I do love to get a baseline test before somebody starts medication if possible. And then that way we'll have a really clean point of comparison. And so for thyroid medication, 6 to 8 weeks after you start it is normally when you would be fine to get another test to see how it's doing. But for the autoantibodies, like once every 3 months. Sometimes immune suppressants will change your inflammatory markers. So you might not see inflammation even though you feel it, because the medications might be masking some of those labs. So that is important to take that into consideration. And that's why diagnosis should never just be testing. It also should be based off of symptoms and things like looking at family history and just coming up with, likelihood that something is happening. When we look at some of the other tests that I only quickly want to mention, I know this is like a lot about testing, but like for rheumatoid arthritis or suspected rheumatoid arthritis, the two markers would be a rheumatoid factor and the other one would be a marker called anti-CCP, and it's just more sensitive than rheumatoid factor for testing for rheumatoid arthritis. And then a lot of autoimmune diseases can occur in multiples where it's not just one autoimmune disease, it's like a collect them all situation. One situation where this is not something that we want to collect, but it just happens that like when the body is compromised enough that you've gotten one, other autoimmune diseases are likely to try to come in. And so one of those situations can be celiac disease. So this is the true allergy to gluten down to a molecule of exposure creating autoimmune reactions in your body. That oftentimes something like celiac disease, which affects the gut directly, can then be that precursor to developing more and different types of autoimmune disease. So when I see people developing multiple autoimmune diseases, I'm looking for one commonality that was the vulnerability. So something like celiac, there's a celiac panel. Most times doctors will just check one single marker, the tissue transglutaminase IgA, or for short, TT-IgA. And so if you see they just did one marker, you can be like, hey, can you do these other markers too? Because I have a family history of celiac disease, or I can't even have a trace of gluten without getting sick. So the other markers are TT-IgG, and then also two other markers called anti-Gluten, IgA and IgG. And so if you get something like a panel of these four markers, plus some other markers that I'll talk about in a sec, but if you get a panel of those four markers, then that would be much better at detecting celiac disease than just one single marker, because sometimes it will show up in the other markers and not in the one that they most commonly test. And then this is great to think about people's choices and how it might influence testing, because if you're currently not eating gluten or not eating that much gluten, then you can't get an accurate read on a celiac panel. You have to actually be actively exposed to gluten. So if you were thinking about going gluten-free, it would be a fabulous time to get a celiac panel before you actually make that change, because it becomes harder and harder to diagnose celiac the longer you've been off of gluten. And so there also are genes for celiac disease that could give us a little bit more information. And then when we hear this IgA, IgG associated with some of these tests, you need to make sure that your immune system is making all of those we call them immune globulins or immunoglobulins, IgA and IgG. You need to make sure that your body actually makes this thing that we're trying to test for. And so getting a total immunoglobulin panel, so IgA, IgG, IgE, IgM, and just making sure that your immune system is able to make these responses in the first place is really a fabulous, this is like deeper than the general testing, but it's fabulous to be able to understand whether or not your immune system has the wherewithal to mount these responses. Because otherwise you'll get tests that look negative, but it might be because you don't have enough of that thing to mount a response. So there are tons of other tests that we can talk about. Stool testing for inflammatory bowel disease, more blood work for lupus, blood work for antiphospholipid syndrome. There are so many other things that we can talk about that we'll try to dive into these subjects individually and then do a deep dive into the lab testing as well as talking about those conditions. But really, in the end, it's like, what are your symptoms? What's your family history? And so M mentioned it, right? Like, M, can you think of our family history? So Hashimoto's, psoriatic arthritis, psoriasis, rheumatoid arthritis.
Right.
So it's like diabetes. And so we're looking at heart disease. So this is our family history. A lot of families don't talk about family history. And so it's kind of like none of your business, you know? But it is some of our business if we're
Right.
looking at what's going
It
on with
tells
our
us
health.
what our bodies are going to do under stress, under these other indicators that we've shared in other videos about what causes autoimmune disease. Like your body is going to have a tendency, because of this shared genetic material, to have similar responses to those stressors, right?
Exactly. And so it's oftentimes a genetic predisposition plus environmental factors like nutrition or trauma, stress, sleep, environmental contaminants or exposures. There are all of these pieces, infections that can then be that catalyst that really lights the fire of autoimmune disease. So it's important to have those conversations, even though they can be awkward or some, like we were saying, some families do not like to talk about health. But just making sure that you're like, what is it that my aunt has again? I think it's autoimmune, but I'd like to know, can somebody be a little bit more clear about this? Because it could help to inform your workup and maybe even your diagnosis. And then when it comes to confirmation, getting the help of specialists, especially when you have enough pieces that are really, it's looking like autoimmune, then going to somebody like a rheumatologist or a gastroenterologist or a dermatologist or a neurologist to be able to get that definitive diagnosis. And you might have to wait 3 or 6 months to get in with that specialist. So it doesn't mean that you can't start doing something about it in the interim, but it is great to, as soon as possible, get a specialist to really work you up and make sure that you get all of the head to toe evaluation that will help you really get a definitive diagnosis so that you can start doing something really specific for your health to improve it instead of just being like, and now it's medications. Sometimes it is medications that people may choose. Sometimes it's nutrition. Sometimes it's holistic medicines. And in my case, it's a hybrid of all of the things. And
Right, right. Yeah, I was gonna ask. I know we want to wrap this up, and at the same time, I'm curious, like, if people choose to self-test and they have their test results, um, is there a way that they can book time with you to help them kind of parse out what does this mean and what might a next step be? Or are there particular practitioners just to like sit with understanding the results? Uh,
yes,
would you
yes.
recommend like naturopaths and functional medicine doctors, or?
Yeah, I would. I feel like naturopathic doctors are the original functional medicine providers, and I say that with full knowledge that actually we're the ones who taught a lot of the functional doctors their curriculum. We still are folks who are teaching functional medicine curriculum, but naturopathic medicine has been around since the 1900s and maybe even longer in other incarnations. But naturopathic doctors are always looking for the underlying cause, and we're obsessed with diagnoses, and we tend to do deeper or more thorough testing. And so that may be true for some of the functional medicine providers in your area. So if naturopathic doctors are licensed in your state,
That's important,
and
right?
you're able to see them, they might then, if they're licensed, they're not as limited in what they can do. If it's an unlicensed state, it's you might be looking for a functional medicine provider who will be able to do some of this testing. And then for me, I do have a coaching session specifically for immune recovery folks, and so people who are part of this community can book through my website, and we can make sure that the link for self-order, self-pay testing, and then also the link for booking coaching sessions with myself or even coaching sessions with M would be available here within our show notes as well. We just want you to start getting answers, right? And if you do have answers,
Absolutely.
like then you get to decide, like, what are you going to do next? What do you want to do? What do you want your path to healing to look like? What do you, yeah.
Absolutely. And once we know what's going on, then we can look for the communities of like-minded people who have similar challenges, and really the sharing of strategies. Once when it's like we're on this precipice of not knowing sometimes, and then so everything's got a question mark. and just getting something so that it's got a period at the end of the sentence, like this diagnosis is, then we can drop into what are my resources, what are my potential steps, and what are my ways of knowing that I'm getting better. Well, whether it's looking at my skin, whether it's looking at test results, whether it's feeling more energized. Um, that can be really nice to have people in that part of their management.
Yeah, absolutely. There's hope, and it really is like your journey kind of starts when you get a diagnosis instead of all of the symptoms that you may have had for years previous. We don't want you to be one of the many people who don't get a diagnosis until 40 years after their symptoms started. The
Right.
earlier your diagnosis, the earlier you can start to do something about it, and then early interventions can really help to change the whole course of an autoimmune disease.
Beautiful. Beautiful. Thank you for that. And thank you for all of the details that your years of reading tests and ordering tests has made you a font of information of how specifically the folks who are going to want to watch this video are going to understand where to start and where to look.
We hope it helps. Thank you so much for joining us. See you soon.
Please subscribe to our channel and hit the notification bell to be notified when we post new content.
Make sure to follow us on Facebook and other social media.